Hello, everyone. My name is Marie Curtis, and I'm an occupational therapist. And I get the privilege today to talk to you about occupational therapy for individuals with Parkinson's disease. I am a member of the UNC Health team. I've been with UNC Health since about 2016. I work in the outpatient neurological therapy realm, so I get to see individuals who live at home but still need a little bit of help with their daily activities. I also have a specialty certification in low vision. So what is occupational therapy? Well, currently, to become an occupational therapist, you need at least a master's degree, and in a couple of years, it's actually going to be a requirement to have a doctorate in occupational therapy. With that aside, an occupational therapist will address what a client needs, wants, and is expected to do in their everyday function. We mean occupation as in what an individual does to occupy their time. What do occupational therapists assess? Well, in the initial assessment in an outpatient setting, an occupational therapist will ask a client about activities of daily living, such as brushing your teeth, to more complex tasks like your vocation, as well as driving and other leisure activities. We try to find if there are any barriers to a person doing daily activities and work with the client to overcome those barriers. In addition to listening to a client's responses about their daily activities, an occupational therapist will assess their upper body range of motion, so looking at how their arms move, looking at their strength in their arms, as well as their hands and their core. And then we also look at coordination, especially in the hands. We also look at what we call functional cognition and vision changes that are frequently seen in Parkinson's disease. Lastly, we have some different ways that we can use adaptive equipment or recommend environmental modifications. So we'll kind of ask you about your home setup and how you do to perform some of those daily activities to see what's a good fit for you. Functional cognition is defined as the ability to use and integrate thinking and performance skills to accomplish complex everyday activities. An occupational therapist will assess how you perform in a specific test to see if there are specific areas to work on to improve or even to maintain independence. We may assess managing medications, work-related tasks, or even driving abilities. In OT, we're looking for areas that can be improved to help someone stay as independent as possible and to keep participating in those meaningful activities. So as we get older, our vision changes, and that's good, that's normal, that's great. But after the age of 40, we really should be getting an annual eye exam because we just want to make sure we're keeping an eye on our eye health. A lot of age-related eye changes start happening after the age of 40, and there's some interventions to help to slow that as well. So as we get older, it may be a little more challenging to see small print or may need more light to read clearly. But what may be related to Parkinson's disease is if you're getting double vision or blurry vision. So at times this could be related to medication, and your neurologist will be able to talk to you about that. Or it could be related to difficulty to control the muscles that control your eye movements. Just like you may have more difficulty to walk, you may have more difficulty to control your eyes while reading. You may also have some more difficulty with blinking your eyes or keeping them open nice and wide so you can see clearly. Your neurologist may have some suggestions for vision changes, or an eye specialist like an optometrist, ophthalmologist, or a neuro-ophthalmologist or neuro-optometrist. If the problem continues, seeing an occupational therapist can help you develop some compensatory strategies to continue with activities that you enjoy, need, and want to do. So there are many different possible adaptive equipments, but today we're a little short on time, so we're just going to talk about the toilet. So as you can see, there are many adaptations that you can do that don't cost a whole lot, and you don't necessarily have to do a lot of big changes to your home to do them. So if you're renting, or it's hard to find a contractor right now to help you with some of the bigger projects, these are things that are pretty simple to do. So here we have raised toilet seats and toilet seats with handles on them. So sometimes with Parkinson's disease, a person may have trouble to get from sitting to standing, and this handles can give a little extra lift so that we can safely get off the toilet. Or at times when we go to sit, we may undershoot just a little bit and miss that toilet. So the handles help to guide you so you can have that tactile, that feeling of where the handle is, to make sure you always get your bottom in the right spot. And the bottom left is a bidet, or at least one example of a bidet. So you can get fancy and get some really fancy bidets out there, or you can even get some that just hook up to the faucet, are pretty simple to install. So the point of a bidet is that it's going to use a water stream to clean an individual, usually after a bowel movement, and it's instead of using toilet paper or wipes. So at times, again, initiating that movement, getting your hand behind your back, and getting a good clean wipe can be challenging. So the bidet can do that part for you. All right, so environmental modifications tend to be a more permanent change to your home. So these are a few suggestions for individuals who have or may experience in the future some difficulty with movement. The intent is to prevent falls or injuries and help someone stay in their home for as long as possible. So the first one we have is doorknobs, and maybe going from the knob to a lever system where it can be easier to open that door or to even pull it closed. There's also options where you put like a silicone cover on the doorknob, or other ways where it's a little easier to grasp it, to turn it. We can think about changes in floor surfaces. Sometimes that plush carpet can be more challenges for a rollator or for a wheelchair, or those throw rugs can actually be a tripping hazard for a lot of us. Sometimes having stair rails, so having them on both sides, can be a little bit more stable going up and down the stairs. Thinking about grab bars, so instead of having the rails over the toilet, having a grab bar installed into the studs of the wall, so you have something very permanent and sturdy to use for sitting and standing, or even in the shower. This can definitely help to get in and out of the shower, or if you sit in the shower, to stand up to clean yourself a little more before you sit back down. Another thing to think about is removing clutter from your home. This can be a tripping hazard. It can make it more challenging to find what you're looking for if there's a lot of items down, or it can help you stay on task, because you might get distracted when you see that photo album when you're looking for the whisk while you're making scrambled eggs. Rearranging the furniture. We have been able to reduce the amount of steps and how long it takes to get from someone's favorite chair in the living room to the bathroom and back. You might also need to change where the furniture is in your house if you need to get the rollator or the wheelchair through certain areas. And then one of my favorite topics is talking about lighting. So different kind of light bulbs you can put in your light fixtures you already have, to either increase the brightness or to increase the range of how far you can light a room. And then also adding task-specific lamps, like a reading lamp. You can put that in the kitchen to help you read the recipes as well. It doesn't just have to be for leisure reading. So we're going to talk about a few specific activities that are commonly addressed early on in Parkinson's. The first is handwriting, which is still common for some people these days. You know, it's not all done on your cell phone or on a computer. For many, it's the first sign that something is changing and that you need to see a neurologist. The ultimate purpose of handwriting is so that you or someone else can read it in the future. So if you make a shopping list and then you go to the store and then you can't read what it says, it makes it really challenging and kind of defeats the purpose of handwriting. So micrographia is a small cramped handwriting, especially when someone continues to write. It tends to get smaller, tends to go down, and it tends to get more cramped up together. So one strategy, and in occupational therapy, if we treat someone who has micrographia and that is a goal that they want to work on, we have a lot of different strategies and different exercises that we do. This is just an example of one. We call it PBS, which is print, big, and space. If someone does print instead of script or cursive, it tends to improve the legibility. We try to remind someone to do big letters so that it can, as it gets smaller as you go, it won't get quite as small. And then just try to increase the space you have between each word. This will help to improve the legibility of someone's handwriting. Many times individuals diagnosed with Parkinson's are still working. These are a few modifications that can be made to help with prolonging an individual's career and being successful in their job. This is where an occupational therapist would make a specific plan to that specific individual and help them to adjust to their work and to advocate for the resources that they need to be successful. So in the workplace, some modifications, if you have a job that requires a lot of sitting, like a desk job, building in those structured movement breaks so that you get up and move. In physical therapy, Deetra is going to mention or has mentioned that getting up and walking and moving your body, the benefit of exercise. So even during your daily activities, it's good to build that in. If you have a job that's standing, you might actually need to take a few more sitting breaks. Thinking about maybe working more days a week or reducing that amount of hours that you work every week so that you can stay in that job for longer. This may take a little bit more financial planning on that aspect. Thinking about distractions, we already talked some about clutter and how that can be distracting when you're trying to make the scrambled eggs, but you see in an old photo album. The same thing in your workplace. You want to have an organized desk, so you could even close your eyes to find what you're looking for, or even your desktop on your computer, having it easy to navigate and things are predictable on your own desktop. And then pacing, that's more thinking about taking those movement breaks or those rest breaks for our eyes, for our brain, so that we can be successful in the amount of time that we are working. An occupational therapist can come in for a job site evaluation to see if there's more ergonomic recommendations to make as well. The last topic for early Parkinson's is driving. So many people ask, can I drive? And the answer is, as long as you, your family, and your healthcare providers are able to deem that it is safe, then sure, of course. So driving is operating a big piece of machinery and can be dangerous to do, not only for the person in that car, but also for other people on the road as well. It is definitely something to take seriously, but giving up driving can take away someone's independence. So it's not something that we take lightly. It's definitely one of the more sensitive subjects that we address in occupational therapy. So when thinking about driving, it has a lot of different requirements that are cognitive as well as physical. So thinking about attention as well as divided attention, you got to keep up with your speed, staying in your lane, knowing where the other cars are, obeying the traffic laws and the different traffic signals. In memory, you got to know where you're going and when you're going to take that turn, as well as how to get back home. Visuospatial. So one of the more challenging things is that left-hand turn and making sure that you are going to actually stay in your lane while you make that left-hand turn. It's also thinking about the distance between you and the car in front of you. Organization. So knowing how to do the different tasks and in what order. So you're going into a turn, you tend to brake into that turn, and then halfway through you start to accelerate again. So making sure those tasks are in that order. Reaction time. we test for predictability to make sure that you can hit that brake as soon as you need to. And then thinking about the physical aspects as well, being able to turn your head so that you can check for those blind spots, ability to operate the different controls, the windshield wipers, the turn lane, turn signals, and obviously the ability to get in and out of the car. At UNC, as well as some other practices, we have the ability to evaluate these skills for driving. We can complete a driving assessment to determine if someone is safe to continue to drive or needs modifications to their driving plan or needs to look into other transportation options. What tends to be the most helpful is to have a list of other ways to get around the community if you are unable to drive. This can be using friends or family, setting up an account with Uber or Lyft, looking into the county resources or the city resources of where you live. It's a good idea to look into what the options are before possibly needing to use them. So again, my name is Marie Curtis. This is my email address. So if you have any questions or concerns or you want to chat about occupational therapy, please feel free to reach out. Thanks so much. Y'all enjoy your day.